And by the way, we're here with Dr. Melissa Jones of Priority Care in the great city of Charlotte, North Carolina. And I picked up Dr. Marty McCary's best-selling book, The Price We Pay.
Mm-hmm.
And the very beginning of it has a hospital story. There was a patient from France, and he was visiting his son for a college, parents' weekend. And he had a problem with his heart, and he was in the hospital. And the next morning, he had suffered an event. And the next morning, they said, well, a rep came in and said, you're going to need a heart bypass within the next few weeks. That's what the doctors told him.
Oh.
And so not long after that, one of the financial reps came in from the hospital and said, well, the price is $150,000, and when would you like to do it? And of course they went, huh? What? Well, let us think about this. And so, okay, fine. I'll come back and visit you. So the second time, now they called the doctor in France who told, because the man is from France, he lives there.
Uh-huh.
And he was told by his doctor there that the same operation would be $15,000. And so they went, So the person came in, the rep came in, and they told him, hey, look, it's sort of, he dropped it down to $50,000. And they went, huh? What? Well, yeah. And they're like, no, that's okay. We're going to, figure this out. Rep leaves. As they are leaving the hospital, the rep came up a final time and dropped the price to $25,000 as they were walking out the door.
Huh.
And so that was the way the book started. And the patients, the entire family loved the docs. They loved the physicians, but they were really put off by the business side of American care. And who can blame them?
Right.
But it tells you, wait a minute, you just went from $150,000 down to $25,000.
Right.
Well, what happened to that 125 that magically disappeared?
Right. You need transparency in healthcare costs, definitely. Yeah.
Yeah, that'll really help. That's really going to help. And by the way, that story is in the first Amazon's free peek inside, so you don't even have to buy the book, although it is a great book, and I would encourage people to learn from it. And do you have any similar experiences along those lines in terms of getting prices from some outrageous number down to something that's more?
Well, not quite 150,000 down to 25,000. This is outpatient, but yeah, it's still significant enough for the patients that come to see me. For one example of this is I had somebody, and she has insurance. She had her labs done with me. I think it was $6 for the initial workup. There was an abnormal lab value, and so I did some follow-up labs. It was standard of care is what I would do with anyone that had the abnormal value. There was a mistake, and they went through her insurance, and I called later to find out how much they charged her. They charged her over $500, and then she has what she calls good insurance. So the good insurance paid over $400 of that, so her out-of-pocket cost was $70. So in her mind, the doctor ordered $500 worth of test, right? So she has good insurance because it covered a lot of it. If she had just done cash pay with me, it would have been $10. And that's just ridiculous that the insurance would inflate the price that much. And then only, because you don't know how much they're actually going to cover. You never know what the real cost of what's being done to you is. And I've only been open 3 months, and I'm already seeing examples of this in other direct primary care doctors that have been open for years they have story after story after story of the system taking advantage of patients because of the lack of price transparency.
Hey, thanks for listening to another healthy snack from the winning healthcare food fight snack bar. If you're finding them tasty, please click like and consider subscribing to have more guilt-free snacks as they're served. Listen to the full show by following the link in the description.